Hello, my name is Dr. Ominde, and we're going to discuss the anatomy of the lecture. So the trachea is the airway, okay, from the larynx to its bifurcation at the sternal angle of Louis. So you can see continuation of the larynx at C6, then continues to T4, T5 junction, which is the sternal angle of Louis, where you have the bifurcation into right and left primary bronchi. So it begins at the lower border of cricoid cartilage, and that corresponds to the C6 vertebra. Then it extends to the carina. Okay, carina is at the bifurcation. It's located at the T4, T5 junction, which is at the sternal angle. So this carina is usually mostly on the right side of the midline. And during inspiration, the carina is at T4, and during expiration, it's at T6. The epithelial lining of the trachea is pseudostratified columnar ciliated with goblet cells. Pseudostratified columnar ciliated with goblet cells. The trachea is 15 centimeters long and has a diameter of 2 centimeters. It is made up of incomplete rings of hyaline cartilage, mainly 15 to 20 incomplete rings of hyaline cartilage, and they're incomplete, so they are C-shaped. So the C is completed posteriorly or bridged posteriorly by smooth muscle called trachealis muscle. So that's the anatomy of the trachea. So air on chest X-ray, this is posterior anterior chest X-ray, this is lateral chest X-ray. So posterior anterior chest X-ray is taken when the X-ray beam is passed from the back of the patient and the film is placed on the anterior chest. So the beam comes from posterior to anterior. That's why it's called posterior anterior chest X-ray. So these are the ribs. Bone contains calcium, so it looks white on X-ray, while air looks black on X-ray. So air in the lungs, they look black. Then blood vessels, blood contains iron, so it tends to block some X-ray. So these slightly white markings you're seeing, these are blood vessels. And blood in the heart, so it has blocked X-ray, so that's why the heart appears white. So calcium in the bone and iron in the blood, they make them look whitish. Then you can see this thoracic vertebra. You can appreciate the thoracic vertebra, intervertebral spaces. These are the ribs. Okay, this is the trachea. Anything black you see is air. So this is trachea. These are the lungs. This is the diaphragm. So this is the left side. This is the right side. This is your costodiaphragmatic recess here. You can see it's an acute angle. Then on lateral X-ray, you can appreciate the trachea bifurcating into two. This is your lung. These are the vertebra, intervertebral spaces there. So this is your arc of the aorta. This is your descending aorta here. Descending aorta, arc of the aorta. This is your left atrium, left ventricle, apex, which is left ventricle, right ventricle. This is your right atrium. Okay, these are the spinous processes of the thoracic vertebrae. This is the clavicle. This is the scapula. When they take this X-ray, the patient is asked to hold the hands by the side, hold the waist on the side, and that way you bring the scapula away from the lung field. So you can see the scapula here. This is the other scapula, and this is your clavicle. So this is the first rib here. Okay. So the trachea is usually variable in shape. It could be round, oval, or flattened, or with a posterior border. It could be squared, it could be horseshoe shaped. So these are the different shapes of the cross section of the trachea. And it's usually very pliable in children, and it may deviate to the right at almost 90 degrees in normal expiratory film. So it may deviate to the right at 90 degrees. So the carina, this is the carina, the bifurcation. So it's usually at T5 level, but during expiration is at T4, and during inspiration it lowers. So it will be at T6 level. The normal angle at the carina is usually 65, 20 degrees to the right of the midline, and 35 to 40 degrees to the left of the midline. What does this tell you? That the right primary bronchus is more vertical than the left. The left is more deviated from the midline than the right. The angle is slightly larger and symmetrical in children. So the angle increases by 10 to 15 degrees in recumbency. So when you're in a recumbent position, the angle increases by 10 to 15 degrees. So from the trachea, you get to primary bronchi, secondary bronchi, tertiary bronchi before you get to the bronchioles. So you get to the terminal bronchioles, to the respiratory bronchioles, to the alveolar ducts, okay, into alveolar sacs and the alveolar. So that's how air moves. So from the nose and mouth to the larynx, to the trachea, to primary, secondary, then tertiary bronchi, then to the bronchioles, the terminal bronchioles, respiratory bronchioles, alveolar ducts, alveolar sac, and alveolar. This just shows you that the trachea bifurcates into right and left, and the right primary bronchus is more vertical, deviates from the midline at a smaller degree than the left. So again, this is your trachea, the primary bronchus, before you get to the secondary and tertiary bronchi. Tertiary also called segmental bronchi. Secondary are the lobar bronchi. So lobar and segmental bronchi before you get to the terminal bronchioles, respiratory bronchioles, alveolar ducts, and the alveolar before gaseous exchange occurs. So the right main bronchus is usually shorter, wider, and more vertical than the left main bronchus. The right main or primary bronchus is shorter, wider, and more vertical. More vertical means it deviates from the midline at a lower degree than the left, 25 to 30 degrees than the left, which is 45 degrees. And then it's 5 centimeters, the left one is 5.5. Okay, so it's longer, it's shorter, wider, and it's more vertical. Why is this important? When a foreign body enters the airway, it's most likely to be dislodged in the right main bronchus. Why? Because it is wider, it is shorter, and it's more vertical. It's more vertically inclined as the trachea. Okay, so things tend to dislodge towards the right than the left side. So the sites of lodgement, when there's aspiration of the foreign body, it most frequently goes to the right bronchus because the diameter is larger and the angle from the tracheal axis is smaller, so it's more vertical. It's actually more in line with the trachea. So airflow through the right lung is greater than through the left. And the carina projects more towards the left, so it prevents things from dislodging to the left. So these are the reasons why foreign body tends to dislodge in the right than the left, because the right bronchus is wider, shorter, more vertical, and more in line with the trachea. And the carina projects more towards the left, preventing substances from going to the left than to the right. What are the relations of the trachea? So the trachea has two parts, a part in the neck, which is cervical part, and a part in the thorax within the superior mediastinum. So the relations of the cervical part, anteriorly, you have the isthmus. The isthmus of the thyroid is found anterior to the second, third, and fourth tracheal rings. Then you have inferior thyroid veins, the strap muscles, sternocleidomastoid, sternothyroid, that are anterior to the thymus. There are also anterior relations of the cervical part of the trachea. So the isthmus, which is anterior to second to fourth tracheal ring, inferior thyroid veins, and the strap muscles, sternocleidomastoid, sternothyroid. What is found posterior to the trachea? You see the esophagus, and between esophagus and the trachea, there is the tracheoesophageal groove that contains the recurrent laryngeal nerve. What is lateral to the trachea? This is the trachea. What's lateral to it? The lobes of the thyroid gland as well as the common carotid arteries. So those are lateral to the cervical part of the trachea. Then we move to the thoracic part. This is the part of the trachea that is in the superior mediastinum before its bifurcation at the sternal angle of Louis. So what are the relations? Anterior to the thoracic part of the trachea, this is the trachea. Anterior to it, you have the arc of the aorta and its branches. So this is the arc. You have brachiocephalic trunk, left common carotid, left subclavian. You also have the left brachiocephalic vein. So mainly brachiocephalic artery and left common carotid are anterior to the trachea. Then you have the left brachiocephalic vein. Remember, it's coming to join the right to form superior vena cava. So these are the structures anterior to the thoracic part of the trachea. What is found posterior to the thoracic part of the trachea? So this is your trachea. That's the anterior part. So these are the structures posterior to this trachea. So you have the esophagus here and the left recurrent laryngeal nerve in the tracheoesophageal groove. So those are posterior to the trachea. In the tracheoesophageal groove, there is a left recurrent laryngeal nerve and there's also the esophagus posterior to the thoracic part of the trachea. Then, what is found on the lateral part of the thoracic part of the trachea? Lateral relations of the thoracic part of the trachea. So, on the left side, you'll see the arc of the aorta. So, this is your trachea. So, on the left side, you'll see the arc of the aorta with the left common carotid and left subclavian. So, those are seen on the left side. While on the right side, you appreciate the right vagus, the azygous arc of the azygous vein, okay, and the pleura, okay. So you have right vagus, arc of the azygous vein, and the pleura. Those will be found on the right side, okay. What's the blood supply of the trachea? So the cervical part of the trachea is by inferior thyroid, which comes from first part of subclavian artery, but the thoracic part of the trachea is supplied by branches from the bronchial arteries, which are coming from the posterior, or rather thoracic aorta. So thoracic aorta will give bronchial arteries to the bronchi that will also supply the thoracic part of the trachea, while cervical part is supplied by inferior thyroid, which are from the first part of inferior thyroid are from the thyrocervical trunk, which is from the first part of subclavian artery. They supply cervical part of the trachea, while the thoracic part of the trachea is supplied by bronchial vessels, which are coming from the thoracic aorta. What's the venous drainage of the trachea? Mainly through inferior thyroid venous plexus. So we said air looks black on x-ray, so this is black, this is air, this is your right lung, this is your left lung, the bones, these are ribs, this is your sternum here, and the thoracic vertebra, you can count them from here. Any black you see is air, so this is your trachea bifurcating into right and left, but there's a foreign body that has dislodged on the right. Remember, we've said mostly on the right because the right is vertical and the carina is mainly to the left, preventing things from coming to the left. This is your heart, okay. This is your left atrium, left ventricle, the apex, which is mainly left ventricle. This is the inferior surface of the heart, mainly formed by right ventricle and left ventricle. This is the right border formed by right atrium, and you have your superior and inferior vena cava here. This is your diaphragm, okay, the domes of the diaphragm. Remember, your arc of the aorta is here. This is the arc of the aorta, and then the descending aorta is right on the left side, parallel to the thoracic vertebra. So this is foreign body has dislodged at this area. Again, look at foreign body on the right side. This is the foreign body. This is your trachea. These are the lungs. These are the domes of the diaphragm. This is the clavicle and the scapula away from the lung fields. Look at this, atelectasis, okay. Because of a foreign body, what has happened? Air hasn't entered this side of the lung, so there's lung collapse. So that's your so thank you very much.